Assalamu alaikum. These days, Karachi is facing an alarming number of cases of eye infections. Every day, dozens of people are reporting in the OPDs with eye infections. So, let's talk about it so that we can try to take measures at the appropriate time and try to contain the problem. Assalamu alaikum. I am Dr. Mariam Ateek, and today we are going to talk about red eye, pink eye infection, conjunctivitis, whatever you want to call it. It is presenting with redness in the eyes, there is pain, there is swelling, there may be watery discharge, excessive tear formation, then this discharge can become pussy in nature, and when we sleep at night, this discharge can dry on the eyelids, forming crusts, and as a result, when people wake up in the morning, they say that they really cannot open their eyes. Then there will obviously be discomfort, there may be some gritty sensation as if something is there in front of the eye, and they can be photophobia, that is sensitivity to light. It gets difficult to look towards the light, it causes pain, and the eyes try to shut down. So why is it going on? The dusty air, the dry air, the allergens in the air, smoke, dust, all these things can irritate the eyes, and it can be either bacterial or it can be viral, and in some cases it can be allergic too. Then there can be chemicals in the air which can irritate the eye. Then there can be those dust and pollen and smoke, and then sometimes the use of contact lenses also causes eye infection. Then people who are sharing makeup items, especially the eye pencils and those eyeliners and mascaras and all, they can also transmit this infection if they are not washed properly after use by each individual. And sometimes even in the newborns, this eye infection can occur, this conjunctivitis can occur because of the blockage of the nasolacrimal duct. So those are the reasons that go on throughout the year, but at this moment it is the seasonal one which has come across, and all these people are reporting with this problem. So how is it transmitted? It is transmitted by direct contact with the ocular fluid that is coming out from the eyes. Usually the eyes are painful, you try to rub your eyes to soothe yourself down, or there is itching, then you're rubbing your eyes, and then when these hands touch other people, like when you're taking care of your children, when you're doing the different daily home chores, or you're writing somewhere, this ocular fluid, when it is wet, it can get the infection transmitted either directly to the other person by contact, or it can contaminate the surfaces. Like if you are rubbing your eyes, wiping your eyes, and then you touch your copies, pencils, books, telephones, the different home items, office items, anywhere, it can go and deposit itself there, and it can stay there alive for around 24 to 48 hours. So if another person comes and sits on the same or uses the same items, the infection can get transmitted to them. So what do you have to do about it? They can be very simple steps that you can do. First of all, contact the doctor, get it assessed whether it is a bacterial one, is it a viral one, or is it an allergic one, or there is some other cause, the general flu, the cold cough is causing it. And likewise, take the advised medication. And what you can do on your personal level: first of all, give the eyes rest. Don't overuse the TV, the computers, the different electrical items that use your eyes. Try to give them proper rest. Then personal hygiene, that is one of the basic factors that can help in containing this disease along with the advised medications. Now, what do you mean by personal hygiene? Do not touch the eyes. Do not touch the eyes with your fingers. Just use a tissue paper or a separate cloth if you are feeling irritated, if you want to wipe your eyes, if you want to rub your eyes, then dispose them off. If it's a tissue paper, dispose it off. in a container which is closed, or put it in a cellophane, tie it up and dispose it. And similarly, if you are using any cloth piece or any handkerchief, then to please wash it frequently. Do not let it dry and then reuse it on yourself, because that can cause the infection again even in you. Then other than that, you have to clean your eyes frequently. You have to splash them with cold water to soothe them down. You can use cold compressors. You can dip your cotton or balls in cold water, and then you can close your eyes and put them on it, and then you can take rest. Sometimes when there is crusting and all those crusts are stuck to the eyes, do not scratch them off and damage the eyelids and cause more pain to the eye. Then you can use a warm compress so that they become soft and they can be taken off easily. Other than that, you sleep properly so that your body can get the energy to come out of it, and then you eat properly again to give you energy and give you all the strength to come back. Normally it takes about 8 to 10 days for it to get over with if only the conjunctiva is involved, but if the cornea gets involved, then it may take 2 to 3 weeks. Conjunctiva, you should know, is the transparent layer that covers the inner portion of the lid, starting from the eyelashes to all over the white portion of the eye. This is the area which usually gets infected. Please do not rub your eyes. So do not share your personal items. Keep your bedding, your towels, your pillows, everything separate. Do not share your makeup items. If you want to share them, please wash them properly, dry them up, put them in the sun so that they can get disinfected, and then the other person can use it, but try to use your own. Do not even share your sunglasses or your spectacles. Keep everything separate, and try not to sit in a place where there is a lot of fan air going over, or there is some breeze, so that these infectious agents, they do not pass on from one person to the other. So take care of these little things. If you are having it, please stay home, get well, and this is your civic duty that you do not infect the others if you're already infected. The doctor will tell you whether it is a bacterial type, which will usually have a pussy discharge. With the viral type, it will usually be redness and watering, and with the allergic type, there will be thickening of the conjunctiva. So the doctor will advise you best. So take care of these things, simple things, and stay healthy. Try to control the disease before it gets out of hand and your whole households get infected. Assalamu alaikum.